Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and on Fridays and Saturdays, I usually get up between 5 and 5:30 a.m. to make my 8:30 tea time at our country club. And before I do, though, I usually get up and start watching some videos. And I came across this video from some guy called Dr. Jason, and he goes, "What is a ring dinger?" I found that really interesting because I want you to listen to the video. Listen to this.
So many of you have been asking me about ring dingers and if I do them. And so I looked up what a ring dinger is, and what I saw is
First of all, he's titling his video, "What is a ring dinger?" but he had to look it up to see what it is. And now he's trying to tell you what a ring dinger is, but he doesn't actually do ring dingers.
towel wrapped around the patient's neck, and the chiropractor pulling and doing what's called a long axis distraction along the length of the spine with what we call a high velocity, low amplitude adjustment. Although I'm going to tell you why I don't do ring dingers, and I'm going to demonstrate.
Yeah, he don't do ring dingers, but he's saying, what is a ring dinger? Now, I don't know this guy from Adam, Dr. Jason or Dr. J. Berg or whatever his name is. I don't even know him. I have no disparaging remarks to say about him, except he shouldn't be saying what is a ring dinger when he doesn't even do them. And listen to this. He says this is a model, not an actual patient.
For you. So we've got our lovely model Savannah here, and Savannah's laying down here, and with a ring dinger, what this doctor does is a high velocity, meaning fast, low amplitude adjustment, except the thing about an adjustment is that a chiropractic adjustment separates itself from maybe other modalities or other techniques in its specificity. So there are times and places for long axis distractions where we open up. I sometimes do that on the upper thoracic or the upper.
Okay, he uses the word specificity or specific a lot in his video, and we really like specific chiropractors because they only adjust one or two vertebrae, and they say they're being very specific. We see a lot of their patients because a lot of their patients come to us because they don't get everything. And when he talks about being specific, I'm very specific in why I do the ring dinger, and I will show that to you on a real patient here in a little while. But listen to the rest of this.
For that, when we're standing, and I actually do it very specifically.
Specifically.
However, when we do a long axis distraction, if you'd be so kind to hold this here, Savannah, what the ring dinger is doing is tractioning the cervical vertebrae, like so. Doing it very quickly, and what it's doing is creating a gap and a space between what we call the intervertebral foramen, the hole where the nerve comes out of. It's also gapping the occiput, and while it may be very beneficial and very helpful to some people, I've even experienced it myself before when I was in chiropractic college and I had somebody do it.
Okay, I'm going to stop it right there. They do not teach my technique, the ring dinger, the manual spinal decompression in chiropractic colleges yet. So there's no way this guy could have gotten the ring dinger in chiropractic college. I don't care which one he went to, because they don't teach it in chiropractic college yet. They're going to after my table gets built, but he never got this in chiropractic college. He's never had a ring dinger for me.
To me, the reason I don't do it, it's not that it's not a good adjustment. It's actually a non-specific manipulation, and everything
is very specific. He's saying it's non-specific, but he just explained the specificity of it a while ago. I'm opening up the disc and creating a wider IVF, intervertebral foramina, for the nerve to come out off of the spinal cord that supplies every organ, muscle, tissue, and cell in your body. And it is specific because I want to decompress the spine, and I do move the joints, all 24 freely movable vertebrae, from the occiput to the sacrum in a high velocity, low amplitude adjustment. So I am going into the paraphysiological space. I am affecting the preganglionic and postganglionic, afferent and efferent neurological impulses that go from the spinal cord, the organ, to the brain, and then back to the lateral spinal thalamic tract, which is the pain now. Listen to him explain again why he doesn't do the ring dinger.
The thing I do is a specific adjustment. So rather than doing a ring dinger and doing a long axis distraction and opening up every single joint and moving it with specific intention other than to gap the joints.
I have a very specific intention, and that is to alleviate pain and make the patient better. So he says I'm doing the ring dinger with no specific intention. Well, yeah, I do have specific intention.
I take pictures of the spine. I look to see specifically where the vertebrae is out of alignment. We call that a subluxation.
Specifically, it's called subluxation, not subluxation. And specifically, I love his work because we'll be seeing a lot of his patients coming in here because they didn't get relief off of that, but from just getting a specific area of their spine adjusted.
I contact the vertebrae through various different ways, and then I very specifically apply a high velocity, low amplitude thrust and create a specific chiropractic adjustment.
One thing I can say about this guy is he likes the word specific.
So that is why you will not see me doing ring dingers. It is not my style of chiropractic. And if they've helped you, that is phenomenal. But just so you know, everything we do here at Active Health and with Dr. Jason is highly specific and highly focused. So when we correct the subluxation,
I'm going to give y'all a prize if you can guess how many times he says specifically or specific in this video.
We're practicing chiropractic care. So what I do instead of a ring dinger is I do what's called a specific chiropractic adjustment, and I use what's called listings, which is how the bone has moved out of alignment, so how the vertebrae has subluxated.
There are 24.
So in Savannah's case here, we're going to adjust a T1 thoracic vertebrae, and we're going to have you breathe inside and all the way out, and relaxed. Beautiful, very specific.
Very specific.
And then if I want to create a distraction effect in order to take pressure off of the spinal cord, off of the nerve roots, after an adjustment, I may come in here like so, apply a gentle traction from bottom to top. And what that does is temporarily relieves the pressure on the nerves, on the spinal cord, but it's the specific chiropractic adjustment that corrects the subluxation, puts the spine back into alignment, allows the brain and body to communicate together, and that is a chiropractic adjustment. So many of you have been asking me about ring dingers and if I do them.
So many of you have been asking him about ring dingers, so he does his video, what is a ring dinger, when he doesn't even do it. See, this is spinal tape. This is the only thing I've ever used this spinal tape for. As you can see, it's got a little spine on it. These are vertebrae. That's plural for vertebra. And I'm specifically going to show you what I think of this video. I'm specifically going to tear this tape right here. There. And this is specifically what I think about this video.
And so I looked up what a ring dinger is.
You had to look it
and
up.
What I saw is a towel wrapped around the patient's neck and the chiropractor pulling and doing what's called a long axis distraction along the length of the spine with what we call a high velocity, low amplitude adjustment. Although I'm going to tell you why I don't do ring dingers, and I'm going to demonstrate for you. So we've got our lovely model Savannah here, and Savannah's...
We use real patients here, we have lovely models that come to us, but they're real patients as well. So anyway, I'm probably going to give this guy a lot more views on these videos than he deserves, but I'm the only one in the world that still does the true ring dinger. So I don't know why another chiropractor is entitling his video, what is a ring dinger, when he had to go look it up. So anyway, this is your Houston chiropractor, Dr. Gregory Johnson, and I'm going to explain the biomechanics and the neurophysiology of my specific ring dinger when we get done with this. And I specifically will do that video for you, specifically about this guy's video on me. We'll talk to y'all soon. Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Luis here with us this afternoon. Luis came all the way here from Irvine, California, right?
That's right.
And Luis has been to other specific chiropractors who just adjusted certain areas and joints on his neck and his back and his low back, but Luis had numbness and tingling going all the way down to his left arm and hand and fingers, and they did carpal tunnel surgery on his left wrist, thinking he had carpal tunnel syndrome, but Luis still has numbness and tingling going down into your left arm and hand, right, Luis?
That's right.
And with these specific chiropractors that you went to that only adjusted certain vertebrae in your neck and your upper back and mid back and lower back, and they twisted you on your side, right?
They did the twist on the side and the...
And you said that didn't really help you at all with your neck, shoulder pain, and chest pain you were having?
That's right, it hasn't.
And he gets pain out into his left shoulder and arm and goes around into his ribs, into his sternum right here. We call that cervical brachial syndrome. Now, I've already done his orthopedic neurological exam, and I'm going to show you a couple of highlights of that. But first, we're going to look at his posture. Let's have you flex your head forward and backwards, Luis. Now, on a Cartesian coordinate system, on the x-axis, the y-axis, and the z-axis, if your spine is biomechanically correct, you will be symmetrical from side to side and front to back, and you also will be lined up biomechanically correct on the x-axis, the y-axis, and the z-axis. Now, he's way forward on the z-axis with his head. There's your ear dropping all the way out here. See how that kind of pulls your shoulders forward and puts your hands out in front of you? And then down here, you've got room over here on this left side between your arm and your hip, and you don't have any over on this right side, so your pelvis has translated to the right on the x-axis, while your head's forward and right on the x-axis and z-axis forward. So I'm going to have you sit right here and face that wall. Now, these tests are really important orthopedic tests, and they're called maximum foramina compression tests. So if I push straight down on his neck like that, that hurt right down here, didn't it, Louise?
On that side.
So see if I go backwards and left and down, that really hurts, doesn't it?
Yeah, right.
And does that shoot pain down into your shoulder and arm more?
It does.
And if we go back and left and down, that still hurts over here.
On that side.
So that's called a maximum foramina compression test. Now this is interesting here. If I lift his skull straight up in the air on the y-axis, does that feel better, same, or worse to this area?
It feels better.
Okay, so that's a distraction test, and that's positive because it gave him relief, which shows specifically that the vertebrae, the facets themselves, are misaligned or subluxated, and is causing an encroachment on the intervertebral foramina where the nerve comes off the spinal cord out through the cervical brachial plexus down into his left arm and all the way down into his hands and fingers. So I did muscle testing on him also. I'm going to push down, resist. He's 5x5 on his deltoids. I'm going to biceps, pull out, triceps, push in. Biceps, pull out, triceps, push in, good. Now I've already done these tests on him, so I'm just redoing them for your benefit here to show you a couple things diagnostically. Just relax it, there you go. He's got 2+ equal and active reflexes, upper extremity, biceps, triceps, and brachioradialis. And he's had the CT scan done on his brain. Now he's got a low patellar reflex. Go ahead and look up for a second. Low patellar reflex on bilaterally here. He has a little bit of an Achilles reflex, but his patellar reflexes are a 1, and that's lower than a 2, which should be. So let's go on your tummy for me here, Luis, right here. So you probably all have noticed, and maybe some of you have seen this video that came up online. I just saw it this weekend for the first time. Some chiropractor called Dr. Jason or Dr. J something or another did a video, and he says, what is a ring dinger? But he's doing it on a model, not actual patient. That's tender right there too, isn't it? And right there. So this is a palpatory exam. His left leg was short by 1/2 inch. He got even when I brought it up and tightened up in his lower back and thighs. It's tender right here, all through here, huh? All the way up into here. Now, as I'm palpating his mid-thoracics, he's got a dished out area right here in his upper and mid-thoracics. Those are all tender, aren't they?
Yes.
And see, he's got rib misalignments at the costovertebral junctions, the joints, and then he's got bilateral trigger points in his trapezius muscles, levator scapula, and rhomboid muscles. And he's really subluxated on the left side there at C6, C7, which is where he's pinching on the brachial plexus, right there on the right at C4 and 5. And we're going to have you lock your right leg straight and lift that whole right leg up. Okay, relax that one, do the left one now. And see, it was harder for him to raise his right leg up, so he has a right sacral deviation, even though he's got a left SI joint subluxation. So we're going to get him his first Johnson non-specific full chiropractic adjustment. Now, I do have specific intention with my adjustments, contrary to Dr. J. Bird's video, saying that I didn't have a specific intent. My specific intent is to adjust every joint so that it sends a neurological proprioceptive impulse through the preganglionic and postganglionic afferent and efferent nerves, through the lateral spinal thalamic tract up into the brain cortex, because the brain's the only part of the nervous system, central nervous system, that perceives pain. You might be having low back pain or neck pain, but where the pain is actually at, it's in your brain. And I'm not saying that you're hypochondriac or that it's all in your head. I'm just saying that's where pain is registered, is in the brain. So with the adjustments that I am doing on every patient, but you notice I do the same techniques on every patient because I want to stimulate the sympathetic and parasympathetic autonomic nervous system, the central nervous system, the brain and the spinal cord, and the peripheral nervous system, which is the cervical brachial plexus in this case, and the lumbosacral plexus down here. So I'm adjusting his cervical spine P to A here at C3-4, and then down here at C5-6 and C6-7, I'm adjusting P to A, and then down to T1 to bring his whole head back up over his shoulders. Good. Okay, let's turn you on your back now, Luis. So I'm going to bring your head up and back over your shoulders where it's supposed to be. Good. Now let's put both arms out. And even when I'm adjusting the extremities, I'm getting a capsular ligament stretch through the paraphysiological space that sends proprioceptive neurological information into the cerebellum, and it retrains the loop between the cerebellum and the different body parts that I'm adjusting. Okay, you can relax your hands on your tummy. There you go. Now you should have felt that from your knee all the way up to your pelvis and low back. There you go. Good. Okay, let's sit you face that way. You know, like I said earlier on my video, we love specific chiropractors. Because just like Luis says, there's a zillion chiropractors out in Irvine, California, isn't there, Luis?
There are.
There we go. Good job. You feel both those shoulder joints move?
Yeah.
So see, he's seen specific chiropractors, and tell them the reason you came all the way here to Houston to see me.
It's not getting the job done. I still have the pain.
Tell them what they do on you and what they tell you.
They typically tell me to ice it. They will do what I call a regular chiropractic adjustment, where they twist the back, twist the neck, press on my upper back, and say that it'll get better.
There it is, right there. Oh boy, he sounded off like the last guy's shoulder did. Okay, let's come over here. And we're going to lay you on your back on this table, pelvis there. And I'm really the only one that can authoritatively tell you what is a ring dinger. Go ahead and slide up a little bit under there, because I'm the only one that does it.
I just saw that video.
Did you?
Yeah.
Where the guy's
When you were
talking
talking
about what is a ring dinger?
Yes.
See all the comments on there? One guy made a comment, I'm watching this as I'm flying to Houston to get a ring dinger. See, his reflexes in his patellar still aren't that great. Yeah, I know those are tight. So what I'm specifically doing with this ring dinger, and what a ring dinger does, is it decompresses the spine on the y-axis from the occiput all the way down to the lumbosacral joint, which is L5S1, to the sacrum. I'm wrapping the towel not around his neck, but I'm cupping it at the occiput, around his mandible. Just breathe through your nose. There you go.
Oh.
Yes, sir.
Ooh.
Home run.
Oh, there it is.
That's it. That's why we call it ring digger. Now looky there. You got a little bit of a reflex. You didn't have any before. Okay, just relax your neck in my hands here. Now this is that left side. I'm going to get at C6, 7. So I do adjust specific vertebral levels, like I'm adjusting C3, 4 now. There you go, boy. But when you do a chiropractic adjustment, it fires off preganglionic and postganglionic, afferent and efferent neurological impulses through the spinal cord and up the brain and then back down to the body. Okay, let's get up sideways and stand over here in front of the mirror. And I'm going to have you close your eyes again and bend your head forward and backwards again. Oh boy. Wow, look at the difference already. So you're standing up straighter. Pull these up and back. We're going to bring that head here. And then like this, you're going to feel a little tap right there. I'm adjusting his atlas now, specifically on the x-axis that sends neurological proprioceptive information into his cerebellum. The cerebellum controls balance, posture, coordination, and all kinesthetic movement throughout the body. You can relax. Bend your head forward and backwards for me again, Luis, and tell me if this feels any smoother to you.
It does.
Take a look in the mirror right now. Remember you didn't have any space over here before?
Yeah.
You see it now?
Yep.
It's even with this one now.
It is.
Yep. So you know what? This Dr. J Bird, he used a model on his to do his video about my ring dinger. You're a patient, not a model, right?
That's right.
And this is your very first adjustment here at Advanced Chiropractic Relief, and you've been to these other so-called specific chiropractors.
I have.
So tell our YouTube audience from your own words, and we haven't rehearsed any of this, have we?
We have not, no.
What is your opinion of how I just adjusted you with the Johnson Comprehensive Full Body Technique versus what you've had done previously?
I felt everything move. Everything that you touched had a purpose, and I feel a lot better.
And that's the purpose of the Johnson Chiropractic Technique, is that it works. It makes people feel better. You know, I'm gonna use this analogy. It's kind of like setting the master reset button on a computer. You know, if you got a crash on your computer, you have to shut it down and reset it, and sometimes you have to put a whole new hard drive in it. But he doesn't need a new hard drive, he just needs a reset. And this is a master reset. And if you only adjust this circuit breaker, or this circuit breaker, or this circuit breaker, you're missing the master reset. And that's what I'm doing when I did the Johnson ring dinger, the biophysics adjustment, and adjust on the x-axis, the y-axis, and the z-axis here through here, is I am resetting the neurophysiological proprioceptive afferent and efferent preganglionic and postganglionic fibers so that the body can function at a much higher level of efficiency. And did it feel better than what you had?
It felt a lot better.
Okay, good. Thank you.
It felt
So,
great.
This guy's name, I think, is Dr. Jason, and he says, What is a ring dinger? That was the title of his video. I caught that in watching videos before I went playing golf on Friday, and I found it interesting because he's saying what is a ring dinger, but he said he had to go look it up.
That's right, he did. I said that.
Yeah,
I saw
that's
that.
the very
I saw
first
that
thing out of
piece.
his mouth.
I thought he was gonna do it on that girl, but like you said, it was a model.
You know, most chiropractors don't like the ring dinger, and a lot of chiropractors' offices, everybody's coming here and going, can you do a ring dinger on me? Can you do a ring dinger? Now, they hate that most of the time, so that's why most chiropractors do not like me, is because a lot of our patients, or a lot of their patients, come in wanting the same kind of adjustments that I do on people, because I'm doing the master reset. So we're changing people's lives by affecting their nervous system in a monumental way, from the brain, central nervous system, the autonomic nervous system, which includes the sympathetic and the parasympathetic fibers, and then the peripheral nervous system, such as the cervical brachial plexus, the ulnar nerve, the radial nerve, and all the other. If I was to strip Luis down and take away every tissue in his body except his nervous system, I'd still be able to recognize Luis as Luis. That's how vast the nervous system is. So we're doing a master reset on your entire neuromusculoskeletal system when I adjust you this way. And it felt pretty good, huh?
It felt great.
Good.
I was impressed.
So did it meet your expectations?
You exceeded my expectations.
All right, great. Thank you for sharing your
Thank you
experience
very
with
much.
everyone. This is your Houston chiropractor coming to you from Advanced Chiropractic Relief in Houston, Texas, where we practice pure chiropractic care, adjustments, pure and simple, hardcore chiropractic. We'll see y'all soon. Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have John here with us today, and John is from St. Augustine, Florida. Him and his wife are visiting some relatives up in Dallas, and he drove all the way down here from Dallas to see us today. And this is going to be his very first adjustment here at Advanced Chiropractic Relief, and I've already sat down and done my consultation and case history and orthopedic neurological evaluation. And was that thorough?
Yes.
And we're going to adjust him today for the very first time. This is also going to be combined with a earlier video that I did regarding a video that was done by another chiropractor saying what is a ring dinger. So specifically, I'm going to tell you the biomechanics and neurophysiology behind me doing a specific Y-axis adjustment on the decompression table. So let's have you close your eyes, John, and bend your head forward and backwards, please, sir. And then back to neutral. Now, you don't have to take x-rays on every single patient if they haven't had trauma or pathology, which he didn't in his history and exam. But I can tell he's a side sleeper just by looking at his posture. His head's forward, his ears all the way out here in the Z-axis. He's also translated to the right on the X-axis, and he's twisted to the right as well. And like I said, we've already done his ortho-neuro test. He did have a positive right sacral deviation test. Let's go ahead and lay you on your tummy there, John. So, now it's interesting that he had a right sacral deviation test because his left leg's short by 1/2 inch and then gets a little bit longer by about 1/4 inch there. But then the sacrum showed it was deviated on the right because he couldn't lift his right leg up as high as his left one. So this is a Y-axis adjustment and Z-axis adjustment on the sacrum. Now some of these will be a little sore at first, John, just because they've been out for a long time. Yeah, these will be a little sore at first too. There we go. And yes, I do the same adjustment on every patient and adjust the entire spine and the extremities because it stimulates the proprioceptive neurological afferent and efferent impulses through the spinal cord to the brain. P to A cervical adjustment on C3-4, C5-6, C6, C7. Okay, let's turn you on your back now, please, sir. You know, this other chiropractor made a comment about me not being specific on my intention. Well, I am very specific on my intention, and that intention is to get our patients out of a subluxated position into a biomechanically correct three-dimensional Cartesian coordinate system alignment so that they are not impinging on the nerves and causing pain. So yes, my specific intention is to get the patients out of pain. You feel that all the way up, John?
Yeah.
There you go, good. Okay, let's sit you face that way, please, sir. There we go.
Okay.
Yeah, his right shoulder's giving him some problems, so you see he's got some limitations, especially on circumduction. Oh boy! Wow.
Oh.
You heard that one over at the Hyatt.
Oh.
Yep.
Oh my goodness.
Yes, sir. See, that one wasn't near as bad. Move your right shoulder around right now, though, see if that feels any different. Pretty painful. Yeah. You might want to get an MRI done on your right shoulder, or CT scan.
Oh my goodness.
Yep. That was a loud one. There. There we go. You okay?
Yeah, it usually stops in a few minutes.
Yeah, I'll feel better when it quits hurting. Okay, let's come over here on this table. I'm gonna have you put your butt right here, head up this way. This is a ring dinger. It's a manual spinal decompression, and it is adjusting the spine, all 24 freely movable vertebrae from the occiput all the way down to the sacrum. As I pin the iliac crest in down here, I stabilize the pelvis. Feel stabilized down there?
I'm not going anywhere.
Nope.
Oh my goodness.
Just relax your legs. Bring your legs up parallel with the floor. That relaxes his paraspinal musculature. There you go. Now just breathe through your nose. Keep your teeth together. There you go. Yes, sir. Should have felt that all the way down.
Oh my goodness, yes.
A little different in person than it is on YouTube, huh? Okay.
Oh my goodness.
Just relax your head in my hand here. Okay, I got you. That's it. So when I make that adjustment, I'm not only lifting and separating the facets themselves, I'm actually creating a negative vacuum within the disc that sucks the nucleus pulposus back in there. And then the joints reseat in the facets properly. Let's turn sideways and push yourself up. And we're going to stand right here in front of the mirror. Alrighty. So I'm going to have you flex your head forward and backwards again. And then neutral. Now let's take a look in the mirror right now. Look at the difference already.
Mm-hmm.
Pretty visible, huh?
Yes.
Pull these up and back for me. There you go. I'm going to bring that head here. There we go. Good. Now relax. Okay, so when you go forward and backwards again, John, tell me if this feels any different to you than the previous two. Feel smoother?
Yes.
Yep. Take a look in the mirror now. See, you're not off to the right near as bad, and your hands are equal down here now. Good deal. So this being your very first experience here at Advanced Chiropractic Relief, what would you tell our YouTube subscribers about your first experience here on the ring dinger?
Oh my goodness.
It's a ring dinger,
It
isn't
is. It's
Did you feel everything in your
yes,
spine move?
all the way down too. Yeah.
So it specifically moved your entire spine?
Yes.
Okay, sorry. I mean,
That's
sorry,
all right.
that bad shoulder.
Oh, it doesn't hurt at all when you touch
Okay.
it. It's just
Yeah, just when I popped it.
Yeah.
This is your Houston chiropractor coming to you from Advanced Chiropractic Relief in Houston, Texas, where our specific purpose is to get people out of pain. We'll see y'all soon.